The following Ardelyx podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hi, everyone. Welcome to today's episode of our Gut Matters podcast. I'm Andrea Shin, a practicing gastroenterologist at UCLA, and I'm joined by my co-host,
Johannah Ruddy, who is the Senior Director of Patient Advocacy at Ardelyx.
For today's episode, our topic is titled Building Resilience, Navigating IBS-C with Strength and Skill. We've always recognized in each of these discussions the importance of IBS-C as a chronic condition. It presents unique challenges impacting not just physical health, but also emotional and mental well-being. So for today's episode, we're planning to explore the power of resilience in navigating the unpredictable landscape of IBS-C. We'll discuss practical strategies and behavioral approaches that can empower patients to better manage their symptoms, improve their quality of life, and cultivate inner strength. I'm really excited to say that we're joined today by a leading GI psychologist, Dr. Lori Keefer, and she's here today to share her expertise on building resilience in the face of chronic illness, and she can share with us other actionable insights to essentially be able to still thrive while living with IBS-C. So just to give a little bit of background, Dr. Lori Keefer is a professor of medicine and psychiatry at the Icahn School of Medicine at Mount Sinai. And she's the director of the Inflammatory Bowel Disease Subspecialty Medical Home at the Susan and Leonard Feinstein IBD Clinical Center at Mount Sinai Hospital in New York City. She's an academic clinical health psychologist. She specializes in digestive disorders, including Crohn's disease, ulcerative colitis, gastroesophageal reflux disease, and of course, irritable bowel syndrome. And she's done this work for over 20 years. She's also an internationally recognized expert. She's done critical work in integrating behavioral health into GI medical settings, and she's the chair of the Rome Foundation's GastroPsych group. In addition to that, she's a prolific researcher. She sustained funding from the National Institutes of Health, the NIH, since 2008, and has extensive experience in the development, evaluation, and customization of behavioral self-management interventions for chronic digestive diseases. And then if that weren't enough, she's also an exceptional mentor, educator, and teacher. She was awarded an NIH T32 training grant in GI physiology and psychology to serve as a mentor for future psychogastroenterologists. And she's a highly sought after clinician, speaker, mentor, and collaborator. So we're super excited to have her here with us today. Her current research focuses on applied positive psychology, resilience building, behavioral interventions, and the impact of resilience-based care in chronic disease outcomes, including irritable bowel syndrome. So we're excited to really delve into those topics today. And thank you, Lori, for joining us.
Yeah, thank you for that very nice introduction. It's really exciting to be here, and particularly I think to see the field really evolve forward to include not just psychological issues, but that resilience, right, which is really a character strength. So I'm excited to talk about that, dive deeper today.
Lori, as you know, I'm a big fan of yours, and I just want to acknowledge publicly how much you've mentored me in my career in this space. And so very deeply grateful for that and for the opportunities that you've given me over the years. So thank you so much for being here today. I think this is such a really important topic for listeners, particularly our patients who are living with IBS, with constipation. Your work uniquely bridges that gap between psychology and gastroenterology, but I think in order for our audience to really understand what we're going to be discussing, I'd love for you to define resilience, specifically for those who are living with the unpredictable challenges of something like IBS with constipation. So maybe you can set the stage for us with defining that first.
Absolutely. That's a great question. I think, the word resilience has become a little bit overused, right? And so maybe with the pandemic and all that, right? Or our economy is resilient, our, institutions are resilient. So I think it's good to take a second and just kind of think about what that means scientifically, right? And so scientifically, when we talk about resilience, we're really referring to an innate character strength that all people are born with as a human species, and something that we can modify and build and cultivate with our experience. And so if you think about the engineering term resilience, where we're referring to a bridge being resilient, right? So you have that bridge between mind and body, I always say, right? And on that bridge, it's not just a rigid bridge from one point to the other. They built it in a way that it can accommodate if the water rises below it, if the wind comes and moves it in one direction or the other. I drive over the George Washington Bridge every morning. I'm really grateful that it's resilient and can handle a lot of cars. And so I think of that in sort of from the gastro space, right? Which is that ability to get from one point to another point, but recognizing that may require some flexibility and that ability to adapt and bounce back. And I think in IBS-C in particular, where you have unpredictability, uncertainty, that is where the challenge is the highest, right? So resilience is the most under threat when you have a situation in your life that is uncertain, right? And I think IBS-C is like one of the worst scenarios for threatening resilience, which is why it's all the more important that we don't forget about that part in our patients.
Awesome.
Yeah, thank you so much that's such a great description of resilience. And I think it really helps put it into terms that we can all understand.
At Ardelyx, we're dedicated to improving the lives of patients by discovering, developing, and commercializing first-in-class medicines that advance care to patients with unmet medical needs. Learn more about us at ardelyx.com.
You've done a lot of work on this theme called Resilience 5.
Mm-hmm.
Could you delve deeper into what these 5 character strengths are, as this Resilience 5 theme, and specifically how might a person with IBS-C actively cultivate each of these in their own lives to better cope with their symptoms or just improve their overall well-being?
Yeah, that's a great question. So over the years, and again, this is where the science of resilience, I think, is really important here. I used to start looking at, these disorders of gut-brain interaction, IBS, really from more of the deficit model, right? So I would say, oh, this person has a lot of anxiety. Let's decatastrophize. Let's kind of help them, maybe relax their bodies more, all of which are great strategies and evidence-based, by the way. But the Resilience 5 really came from, what about those people who have really difficult situations and still find a way to live their best life, right? How can we bottle that up? And what do they have that we can sort of give to other patients who maybe are less fortunate or haven't had experiences that have built that? And so that sort of was a huge career shift for me, actually, from early on, where I was looking more at that pathology towards this positive psychology framework of, what can we give people? And that's where those 5, Resilience 5 came about, right? So we studied patients and we tried to understand who does well, why do they do well, and what about it can be sort of quantified so that we can actually turn it into an intervention and give it to somebody else. So to make up that resilience, which again is that ability to flex, bounce back, thrive, adjust despite obstacles, we kind of start with disease acceptance, right? And I think this is really the first character strength that we're going for in a lot of our behavioral interventions, which is accepting that something happened to me, something went wrong, I have this. I may not like it. Acceptance does not mean I approve of it. It's not that I signed up for it or I'm really glad I have that silver lining that I'm a better person because I now have a chronic GI condition. We don't worry about that part.
Or that you did it to yourself, you caused it. Yes.
I caused this. I did something wrong, right? It's all about that acceptance and the ability to say that there are things about this that I may not be able to control, and there are things that are, right? And so many of our early interventions are focused on that acceptance being an important component. The second one that we kind of focus on next is what we call learned optimism, right? And that is more than glass half empty, glass half full, which I think we all can appreciate. It's a choice and it's an attributional style. And this is cognitively where we see some real character strengths. Optimists are much more likely to take credit for the good and put the blame for the bad on others. So we always say when a bad event happens, like a diagnosis of IBS-C, like a treatment failing or not working for you, rather than sort of see it as something that's personal, right? I did something wrong. This is a punishment. This is a sign. You're sort of not taking that so personally. You're not taking it as permanent. So that's the second P in the 3 Ps of optimism. It's not permanent. It's going to get better. I just don't know how yet, but things aren't going to be this bad forever. And the last one is pervasive. Just because I have this problem doesn't mean I can't parent, doesn't mean I can't be a good wife or daughter or worker. I just happen to also have this problem. So that's number 2 is the optimism. 3 is our our ability to regulate our feelings and emotions in our best interest. That is like, can I sit on the phone and talk to my insurance company about getting a drug approved without yelling and hanging up on the person? And
Very difficult to do sometimes.
can I tolerate the distress of that?
Yes.
Yeah. 4th is community, which, I think is very important. And you guys both know that in your own work with patients and advocacy, that really having that community, that social support, that ability to really have people in your life that get you and help you. And then the last one is that self-confidence. So the last strength is that, can I do the things I need to do, right? Can I sit on the toilet and do have my bowel movement the way I've been taught? Can I swallow a pill? Can I can I get a good night's sleep? What do I need to learn to do this? And you're saying before, it's not just the mindset of resilience, it's the skills of being able to self-manage. Taken together, most people have at least 3 of those things going on already. We just identify which of those 5 might need the most targeted intervention, and that's how we focus our treatments.
That's so cool. I love that. So that, I was thinking, sometimes patients will say to me, like, I wish there was a secret sauce that I could, that would be like my go-to. And I feel like you just described the secret sauce. Like, this is how you can do this and still live the life that you want to live. And it's not about bouncing back or being optimistic uncharacteristically. It's about concrete skills.
That's right.
So I really, really appreciate that. I think, when we talk about IBS-C, it's very unpredictable. So you have these ebbs and flows of flare-ups and pain and changes in bowel habit, and sometimes everything's working well, and then the next day you're back to that constipation and abdominal pain again. So it can be really disruptive, and it can be very easy for patients to fall into that hopeless cycle that you described. So I'm curious, from your psychological expertise, how can patients develop maybe a greater tolerance to this and the uncertainty of this condition, and maybe some specific and practical self-regulation techniques that you might teach to your patients to help them kind of manage that unpredictability and that anxiety that can many times exacerbate the symptoms and send us all kind of spiraling?
Yeah, exactly. Yeah, I love that idea too. I mean, you're right. It's all about self-regulation.
Yeah.
And one, I think there's a couple different approaches. One is being able to regulate in the moment. So what do you do when you're having pain, when you're doubled over, when you know you have to run somewhere, but you haven't been able to go to the bathroom yet, right?
Yeah.
So what is that real time in the moment? And often that is really kind of doing things that are going to engage your parasympathetic nervous system, right? So that's where things like deep breathing and relaxation of muscles and maybe abdominal massage or, those kinds of things are really, really helpful. So I always like my patients to have one go-to in the moment, real-time technique that they can use to sort of regulate. The second part, though, is the day-to-day regulation of having self-compassion in particular, loving kindness meditations I'm a big fan of, coping statements that you use to just remind yourself, I'm human, I'm on this journey, I'm not perfect. Some days are going to be better than others. I can have compassion for myself. If I don't feel like doing something, it's okay, right? I think a lot of times we just feel, especially as women, feel that pressure, right, to always be something for somebody else and feel like we're failing. And so I do think that is another self-regulatory strategy that if you can build into your day, in general, makes it a lot easier to live with this unpredictability.
That's such great advice, and I think could be so useful for so many individuals to really feel empowered to have some sort of skill or something that they can fall on because you never know when symptoms will flare up. Um, a lot of people with chronic conditions, they in general feel often defined by their illness. And that can lead to feeling very helpless or the sense of like, why me?
Mm-hmm.
Why am I in this situation? Um, and so I'd love to get your insight on how individuals with IBS-C who struggle with that could help themselves shift their mindset from being controlled by their symptoms to, getting more in the driver's seat or having some empowerment in managing a condition that, they are living with and still get a full life. What's the role of acceptance in this transformation process, and how can someone work towards accepting a diagnosis that, may be hard to come to terms with, or, maybe in the beginning we even resist the diagnosis?
Yeah, that's such a good point. I think acceptance is one of those things that we never fully accept, right? And that's probably a good thing. Like if we don't fully accept, we don't want to settle, right? I mean, there's a lot of reasons to not accept the fact that I'm having this problem and pushing my doctor, pushing the scientists to find something better, right? So I don't think that we want to just, to sort of take it and say, all right, your life's over, just move on. So it really is this negotiation, right? Constant negotiation around what I can accept, what I'm going to have to accept versus what I can push for and what I want to take under my wing or empower myself. And again, that goes back to that flexibility, that resilience and the bridge, right? When should I just stay the course and when should I push the envelope a little bit? And I think it could take a life to do that, right? I think we never kind of get there, but it's a process. And so in that vein, I think really kind of trying to be aware of what you're saying to yourself on a daily basis about your condition, right? I have this, right? I'm living with this. I mean, some of the words that have really changed the field, in my opinion, are people living with this condition, right? Instead of just, I'm an IBS-C patient, right? It's like, no, I'm living with this. I think that's very empowering. I'm living with this,
Yes.
right?
Absolutely.
So I think watching what you say to yourself, making sure when you say, why me? Why not me? Right? I think that, why not me? Why shouldn't something, difficult happen to me? I can handle this. Right? I think we want to not feel that helplessness. This is happening to me. I don't have say in it. I agree it's bad. Bad things happen to good people. I can accept that. I can move on. But really watching that self-talk, I think, is part of the acceptance over time, and knowing when to push. And this is where having friends, having support systems, having doctors that you really trust is important to say, hey, doc, is this something you think could get better, or am I like kind of stuck with this, right? Ask about it. Like, what is the reason? What's a reasonable expectation here? Am I, should this be something I tolerate or not? Let me not just make an assumption.
That leads us so perfectly into my next question around social isolation with patients, right? And a lot of our patients talk about not wanting to leave the house due to the unpredictability of their bowels and their pain, and feeling embarrassed and really withdrawing from all social activities, from engaging with friends and family, and even, family members that live in their own home with them. So I think, I'm curious how you would describe some strategies for building and nurturing relationships when you're living with this condition, and really more than that, but communicating with those who you love and who love you about the nature of this condition and how to best be supported. Because I think family members and friends many times can feel really helpless, especially if this is, something they don't deal with themselves. It's like, I want to help you, but I don't know how to support you best. And I think we as patients many times don't do a good job communicating what we need. We just say, forget it, just leave me alone, and go to our room with our heating pad and isolate ourselves. So I'd love to get some strategies from you on communication and building that relationship.
Yeah, no, that's a great question. So social support obviously is one of our Resilience 5. And the reason for that is what you just said. Going through difficult times requires other people, right?
Yeah.
If you haven't read the book, why do zebras not get ulcers, right? The spoiler alert, they don't get ulcers because they live in a community, and the herd offers them against stress, right?
I
So
love that. That's so cool.
yeah, so it's always good to go to the animal kingdom and take a look at at some of these lessons learned, but particularly around social support. I think there's a couple things. So one is, there's different types of support we need with these conditions, right? We need the practical, informational, and emotional support. So practically speaking, who's going to pick up our medications when we can't leave the house? Who's going to go grocery shopping when we're in a lot of pain and discomfort, right? Who are those people? Who are the people that provide you information, the latest on medication, the latest on lifestyle changes, the latest on, fiber, where do I get that information from? And then who's going to provide me that emotional support, the person that I can call and just say, I don't feel good. And that person isn't going to try to just fix it or give me information or practical tips, but it's going to just let me cry on their shoulder. Mm-hmm. And I always tell patients, let's figure out who fits in each of those categories, because those aren't the same skills. Some of our friends and family members are really good at practical support, but you would never ask them for the latest information about something, right? And some people are really emotionally supportive, but they live in California and they can't come help me in North Carolina, right? So I think making a point to sort of identify who can help you with what. No one person can help you with everything, right? So if you think about not expecting or putting that on one other person can be really, so delegate. And then also really kind of on the patient side, think about what it is you need and be specific. Because I think the other big complaint people have is someone says they'll help me, but they don't actually help me. But, a lot of times people don't know what you need. So like, hey, you know what? On Thursday night, I could really use a ride to this event, right? Would you be able to help me with that? I think 9 times out of 10, people are naturally helpers, and they're happy to do something if they're asked. They actually feel good about helping. Like, oh, this was great. I was happy to drive my neighbor to the, to the grocery store or whatever. So I think it's on the patient to or the person living with the condition to really know what they need and who they need it from, and then those on the other side to really kind of help figure out what they can do to be supportive. So it's kind of a combination.
That is such a helpful way to kind of break things down, because I do think it's very often, people will say, let me know how I can help.
Yes.
But even
Yes.
when we, like, as people use that statement, sometimes I feel like I'm putting this out there in this vague, then the onus is on, the person but to really kind of be able to break it into different categories, it makes it more, understandable.
Yeah.
Yeah.
And you just feel more supported that
Right.
way. And then you can also set boundaries, to your point earlier about
Mhm.
how do you communicate your condition to people.
Right.
If you kind of know what you need from them or what categories they can help, like I always say, master your elevator pitch about what
Mhm.
you have and what you need, right? And you can tailor that to your audience. So with my
Yeah.
family, I might be a little more specific or graphic,
Yeah.
right? With my boss, I might be a little more abstract, but I
Right.
have a sense of this is what I live with, this is how I manage it. And
Yeah.
sometimes you may find that I disappear for a while to sit on the toilet, or you may
Mhm.
find that sometimes I have a heating pad on underneath my blanket at my desk.
Yeah.
How does it affect me? So what do I have? What am I doing about it? And how does it affect me in relation to you? Can
Mhm.
sometimes take away some of that anxiety of I'm not going out because I can't even describe what I have right now.
Yeah, absolutely. So Lori, another thing I wanted to ask you about, you've developed something called the GRITT method.
Mm-hmm.
And I think it would be really great for our listeners if you could explain what GRIT stands for within this, method,
Yeah.
and how it's a systematic approach, how it actually can help people build resilience,
Yeah.
enhance their self-management skills for chronic GI conditions specifically, and what are the
Mm-hmm.
core components of the GRIT method.
Yeah.
Um, and then beyond that, if somebody wants to learn a little bit more about it, how could they go about learning more?
Yeah, that's great. I love talking about the grit method. So you're already getting a little flavor of it, right? Because we're talking about it's really based on this resilience concept. It's called gaining resilience through transitions, and the idea is really that those are transitions in life are times to grow and build resilience. And so our job is on your health journey as you make transitions. We're there to kind of support you. And what you need at one time of transition may not be what you need in another point in time. And so I always joke with our patients, I'm on retainer, right? I might work with you for a couple sessions and then I don't see you again for 5 years, but then you graduate college and you come back because you need you need a new transition support team. So that's the broad framework. And then the underlying that is the multidisciplinary team. So the idea is that no one professional is the ideal. Just like we, spread out our social support, some people need help in different domains. So that might be a dietitian, right? That might be a nutrition domain. You may need a clinical pharmacist we have on our team, right? You have a physical therapist potentially, maybe a social worker, a nurse educator, a patient advocate. Like there's a village of people that can help you. And, rather than overwhelm you, which I think we often do, where we say to the patient, oh my goodness, you have this condition, you need you need to change your diet. You got to start exercising. You need more fiber. You need to see the pelvic floor physical therapist. Have you had manometry? Or what about acupuncture? And the patient's like, what? Like, I
Yeah.
can't even get out of the house. Like, why do you want me to do all these things? So our job is really to say, knowing you're going through this transition, knowing what your character strengths and limitations are, which domains are we likely to have the most bang for our buck? Let us tell you what order we think makes sense. So I always use the example, if you're really, really depressed because of your IBS-C, and having trouble even getting out of bed in the morning, right? then seeing the dietitian to start on like low FODMAPs is probably too much for you, right?
Yeah, right.
So maybe that's where you're working more with the psychologist. Maybe that's where you need a medication for that. Maybe you need to kind of work on your mood before we add something else on, and vice versa. If you haven't eaten in 6 days because you're so full and have abdominal pain and you're hangry, maybe starting with your diet is a better strategy. So we kind of focus on that. And then within there, we're able to kind of say, okay, now we know who you need first, second, and third, maybe. And then the whole team is still talking about you together with this shared language of resilience, right? And so this way, we all might be different experts and different professionals, but our approach to the patient is always around, how am I going to build resilience through diet? How am I going to build it through exercise? How am I going to build it through neuromodulation? We're always talking about it from that lens. So that really helps. That trickles into the patient, right? Because the patient then gets a consistent message that makes sense on their brain gut journey. And we have seen, studied the outcomes of that, right? Which is increased resilience over time, reduced unnecessary healthcare, and overall just better outcomes, right?
That's really cool. I've just loved listening to, I mean, obviously I knew about this work that you've done, but not to this level of granularity. And I just am eating all of it up. It's fantastic and coming at a very apropos time in my life. I'm curious about any other recommendations that you would have beyond the Resilience 5 and the GRITT program. What else? I mean, you mentioned briefly some of these evidence-based brain gut treatments like CBT, like gut-directed hypnosis and other mindfulness techniques. What else do you typically recommend to your IBS-C patients to continue to have positive impact on their management and quality of life?
Yep, that's great. So I really think that, with IBS-C, it is really recognizing that it's multifactorial, right? And that's where, because you have, it's not just constipation, it's pain. Yeah. It's not just pain, it's constipation, right? So I think that you're always having to kind of blend that approach, and something that helps with one may not help with others. And so these brain gut behavior therapies are particularly good because they really do target that pain in particular,
right?
That ability to kind of not feel that pain at the level of the gut as threatening, as an emergency, not encoding all the emotion with it. But it's not sufficient if you're not going to the bathroom.
Right.
It's not sufficient if things aren't working and moving through. And so you kind of need an approach for that too. And so I really think, particularly in IBS-C, you're really wanting a comprehensive approach that you can implement over time, and not really ignore one or the other, and make sure you're working with across the board.
So for someone who is potentially feeling really overwhelmed by their condition and, expresses that they're losing hope, or just someone who's going through that because of, IBS-C symptoms, because of how severe they are, what would be your message to them? Like, how would you give them initial advice and where they can start in building resilience when they're feeling like they are at their lowest point?
Yeah. So we always talk about, when you feel you're at your lowest point, that's when you need to stop digging deeper, right? Digging yourself deeper into the hole, right? And so I think that's when you start looking for your way out. And I think a lot of this, it is overwhelming. And, a couple of my patients will say they just want to make, we try to break it down into dents, just make a dent every day in this, put one more, handful of dirt back into the hole you've dug yourself into. right? And because I think we often think about it as like, I can't live like this. This is unacceptable. I might as well just give up, right? But there are little wins, and I'm a big fan of savoring some of those wins, those little ways in which you made a dent, a commitment to yourself to just make the day a little bit better. One good thing, right? One thing you're grateful for, one thing that you did for yourself. We get caught up in our negative emotions, and there's a lot to celebrate too about ourselves and the people that we love. So, and I don't mean that in a, just be happy and positive way, but in a sort of really concrete, we need to make a point to make sure we're still encountering positive emotions and putting the dirt back into the pile for ourselves. And how we do that may depend on who we are and what access resources we have. But I do think that that's really important for patients to recognize there is hope, and it comes in small incremental dents, but you will get there, right? You always get there. People are resilient by nature. It's just how long does it take? How much do I suffer first before I get to that end game of a resilience?
Yeah.
Yeah, I appreciate that very much. I think that, to your point, gratitude and always trying to celebrate little wins and being thankful for those little wins. Like I remember in my sickest moments of IBS, not being able to do anything with my kids. And then once I was able to just go to half of a soccer game successfully, right? I was like, yes, I didn't make it through the whole game, but I made it through half of the game, and I saw my kids score a goal, and that, celebrate that, and then build on that every day. And so I really appreciate that message. I think that's beautiful.
Looking ahead to the future, what do you see as kind of that next horizon for psychological interventions and resilience building, specifically for the treatment of chronic GI conditions like IBS-C? Are there new approaches? Is there new research that's ongoing and active that you might be particularly excited about?
Yeah, that's a great question. I mean, don't get me started. All the different ways to do it. I think we've already started to see a much earlier, more proactive attempt to get at this integration up front, right? And I think that will help both in terms of diagnosis and early intervention. It used to be you didn't get in to see the psychologist until you had literally everything had failed you. Everything you'd
Right.
done was no longer working. And I think that, we don't do that anymore. And I think that in and of itself, just the conversation that we are no longer separating out brain and gut, it is huge and has opened up a significant door. And that's not even just in psychological, that's microbiome, that's, a lot of things, just recognizing the complexity of these things up front, and also not being afraid to test things that get at these big questions, these big mechanisms, right? I think is huge progress. I'd like to see a little more conversation around these strengths-based positive psychology approaches, because I would like to move away from, many of us who are in the field don't think this anymore, but I do think there's still a lot of belief in the psychosomatic model of these conditions, right? And I think by reframing this, most people with these conditions do not have a psychological disorder.
Right.
Most people with these conditions do not have deficits in their, coping strategies. And so I think there's still plenty of room to grow here and start. And I really hope that resilience is the way we do that, right? Because there's psychological and physical resilience that we have to have as people. That maybe that's the language that will get us to that point where we don't have to see this in such a deficit way, and that will open up new treatments.
And really reduce stigma that patients feel too, which is such a huge part of this condition. So
Yeah.
Right.
Yeah.
Yeah, no, that's so great. I mean, even from a health economics standpoint,
Yes.
there's research coming out that the earlier we use integrated approaches, the better the outcomes and actually how it reduces spending in a healthcare system.
Yeah, yeah, and time off of work
Yeah,
and more time with your children, and right. I mean, I think
Absolutely.
right.
yeah,
Mhm.
there's a lot of downstream, and really, it's less expensive to build resilience than it is to come up with a new surgical solution for
Right.
problems.
And it's better for patients, for goodness sakes. Like, can we just do what's better for patients? That would be amazing.
Yeah.
Yeah.
Yeah, that's awesome. Lori, this has just been so great. I really appreciate you joining us on this episode and walking us through the process of building resilience in chronic conditions, but particularly in IBS-C. And is there a place that patients can go online to find out more, read a little bit more? Any place you'd recommend?
Yeah, so I think a couple things. One is like there's a lot to be, there's a whole positive psychology institute at the University of Pennsylvania. So I definitely think there's a lot of fun stuff there that you can
Great.
follow and do. And then, even like my lab website at Mount Sinai also has a little bit more on the GRITT method and some of our papers on the topic as well. So I highly recommend that. Yeah.
That's perfect. And we'll link those in the show notes as well. So I think we're running short on time, but I just want to thank Lori again for joining us. And Andrea, always a pleasure to speak with you as well. And we'll see you all next time. Thanks, everyone. Take care.